Hi, good morning everyone. This Capstone project is presented to St. Bernadette of Lourdes College Graduate School Department. This is in partial fulfillment of the requirements for Master in Hospital Administration entitled Converting Regular Budget of Procurement to Consignment System in Supply Chain at Batangas Provincial Hospital. Background of the study. First, vulnerabilities in traditional supply chains. Reliance on a limited number of suppliers create risk, particularly when they fail to meet delivery schedules or quick quality standards, while the lack of real-time inventory visibility and unpredictable lead times heighten the risk of supply shortages and complicated decision-making. Next is challenges in procurement and inventory management. Outdated procurement system, unregulated purchasing processes, and poor interdepartmental communication can lead to inefficiencies in inventory management. This includes problems like stockouts, overstocking, and rising costs due to emergency orders. These issues can lead to delays in acquiring essential medical supplies and the effect of the hospital's operational stability. Next is legal and regulatory compliance. Compliance with healthcare regulation and procurement laws, such as those outlined in Republic Act 9184, is critical for government hospitals. Failure to comply with procurement processes and standards can result in legal repercussions or fines. At the same time, implementing strategies like consignment stocking could help modernize and streamline procurement, improving efficiency and adherence to regulations. Next is consignment stocking as a solution. Consignment stocking offers a solution to procurement inefficiencies by allowing hospitals to acquire medical supplies on a pay-as-you-use basis. This method reduces the financial burden on the hospital by minimizing the needs of upfront payments and provides flexibility for returning unused stocks. Study shows that consignment can optimize inventory management, enhance product availability, and reduce costs, especially for high-value items in healthcare, like implants and diagnostic equipment. Lastly is the case study at the Batangas Provincial Hospital. The study focuses on Batangas Provincial Hospital, a 50-bed capacity facing significant procurement challenges. Inaccurate demand forecasting, PPH currently reliance on the traditional procurement methods has led to inefficiencies, highlighting the potential benefits of switching the consignment stocking for a better supply chain management. This research aims to identify which medical supplies could be effectively procured via consignment, potentially improving operational efficiency and patient care at the hospital. Next is desired impact and outcome of the study. First, enhance inventory management. The study aims to improve the efficiency of inventory management at the Batangas Provincial Hospital by identifying medical supplies suitable for consignment procurement. This would address challenges like stockouts, overstocking, and the low processing of traditional procurement system. Next is cost optimization. By adopting consignment stocking for specific supplies, the hospital can reduce upfront costs and minimize emergency procurement expenses. The desired outcome is to lower procurement costs, optimize cash flow, and improve budget allocation for essential resources. Third is improve supply chain efficiency. The implementation of consignment stocking is expected to streamline the hospital supply chain, allowing for faster stocking, more accurate demand forecasting, and better alignment between departments. This would improve overall operational efficiency and reduce delays in medical supply availability. Fourth is better patient care. With more reliable access to medical supplies and better inventory control, the hospital can avoid shortages of critical items. This would directly contribute to improved patient care as departments would have timely access to necessary medical resources. Fifth is compliance and transparency. The study aims to ensure the consignment procurement model aligns with the guidelines of Republic Act 9184 and other regulatory standards. The desired impact includes improved compliance with government procurement regulations and enhanced transparency in hospital procurement processes. Lastly, scalable and Republic model. A successful implementation at BPH could serve a model for other government hospitals facing similar procurement and inventory challenges. The outcome is to develop a scalable consignment procurement strategy that can be replicated to benefit other healthcare institutions. Next is the beneficiaries of the study. The implementation of the consignment inventory models offers a multitude of advantages for various stakeholders within the BPH hospital. First is the hospital administration. For the hospital administration, it provides a means to optimize financial resources by minimizing the needs for large upfront investments in medical supplies. This frees up capital for other critical areas such as patient care or facility improvements. Next is healthcare provider. Healthcare provider also stand to benefit significantly from this model. By reducing the immediate financial burden of the acquiring supplies, they can focus more on delivery high-quality patient care. The availability of necessary supplies on-site ensures timely interventions and reduces treatment delays, ultimately improving patient outcomes. Next is patients. Patients directly benefit from enhanced access to medical supplies, leading to improved quality of care. With essential items readily available, healthcare providers can respond promptly to patient needs, reducing the likelihood of treatment disruptions. Next is the supplier. From a supplier's perspective, a consignment model can strengthen relationship with hospital and create new business opportunities. Suppliers can foster trust and collaboration by sharing inventory management responsibility, leading to a more integrated supply chain. Next is the finance department. Finance departments can benefit from improved budgeting and forecasting accuracy. With clearer visibility into inventory levels and consumption patterns, they can also allocate resources more effectively and prevent over-ordering. Additionally, reducing administrative burdens associated with purchase orders enhance efficiency with the finance department. Next is the logistics. For logistic teams, the consignment inventory models offer enhanced visibility into inventory levels, enabling more informed decision-making regarding ordering and restocking. Real-time tracking of usage patterns help identify trends and anticipate needs, leading to more proactive inventory management beyond the hospital, and consignment model also benefit the broader community. Lastly is the community. By improving hospital efficiency and quality of care, it enhances the overall health and well-being of the community members. Reliable access to medical supplies ensures timely and effectively patient care, reducing treatment delays and improving outcomes, especially in critical situations. Next is methodology. First is the research design. A descriptive qualitative design will be utilized, which involves the collection and analysis of numerical data to describe the sample from inventory data years 2022 to 2023. This will demonstrate the mean standards deviation, frequency, and percentage. This research will employ a retrospective design utilizing secondary data obtained from the inventory purchasing department of a healthcare facility for the years 2022 and 2023. The data will encompass medical supplies across various categories, including laboratory, dental, hemodialysis, x-ray, medical, and drugs. By examining historical records, this study aims to identify trends, patterns, and potential correlations within the purchasing data for the medical supplies. Next is the data collection. This study utilized the 2022 and 2023 hospital inventory records as the primary data source. This Comprehensive records derived from original documents include a detailed list of products added annually. The inventory data was obtained from the hospital purchasing department and underwent a cleaning process to eliminate all quotation except from the lowest bid for each product. These initial data collections included products, then subsequently, the price data was entered into a designated data. The study proceeded to a secondary data collection, allowing the initial data cleaning process. This phase involved gathering supplementary information from external resources to complement the primary data obtained from the hospital inventory records. Specific sources of the secondary data included industry reports, inventory management materials such as the Project Procurement Management Plan or the PPMP, medical dental inventory, and other relevant supply chain documents from the hospital setting. These resources provides insight into broader market trends, healthcare spending, product specification, and pertinent research findings. By integrating primary and secondary data, the study aimed to gain a comprehensive understanding of the factors influencing medical supply purchasing decisions and price variation within the hospital. Lastly is the data analysis. Simple descriptive statistics were employed to analyze inflation-adjusted unit purchase prices. To quantify price changes between 2022 and 2023, percentage price changes were calculated for unit prices. Cross-tabulation and Pearson correlation explored potential relationships between purchase requests, order per unit, and significant unit price differences. To facilitate analysis, purchase orders in units were dichotomized into binary variables, 0 for sufficient supplies and 1 for items requiring purchase. A graphic presentation was created to visualize differences in purchase item per unit across various categories, including laboratory, dental, hemodialysis, medical, X-ray, and drugs. Next is the work plan. Our work plan on the phase 1, the planning duration is 1 to 2 months. And then next is assessment of BPH medical supplies. The initial phase of the implementing a consignment model for medical supplies involves a comprehensive needs assessment. This process entails identifying specific medical supplies from various departments such as medical services, radiology, laboratory, hemodialysis, pharmacy, and dental of Batangas Provincial Consignment, suitable for transition based on factors such as usage pattern cost and supplier availability. To ensure stakeholder buy-in and address potential challenges, it is usually to engage key stakeholders including medical staff, procurement teams, and department heads. Next is the stakeholder engagement. To ensure the successful implementation of the consignment model, it is crucial to obtain buy-in from all relevant stakeholders. This involves organizing meetings with hospital administrations, department heads, and staff to effectively communicate the benefits of consignment inventory management and address any concerns. Clear explanation of the proposed transition, including anticipated advantages and potential challenges, are essential to foster understanding and support. The outcome of the stakeholder engagement process should be documented in a comprehensive summary and outline the discussion, feedback, and consensus reached. Next is the supplier identification. Supplier identification and selection are critical steps implementing a consignment model. Potential suppliers with experience in consignment models should be researched and evaluated based on factors such as reliability, product quality, and pricing. Shortlisted suppliers should be requested to submit proposals, and negotiations should be conducted to establish favorable terms and conditions. The outcome of this process is a list of approved suppliers and financials consignment contract outlining the specific terms, responsibilities, and expectation of both parties. Next is contract development. Draft consignment agreements outlining terms, responsibilities, and expectation, including inventory management responsibility, examples, stock replenishment, tracking, pricing, and payment terms. It also includes dispute resolutions, mechanism, and other applicable compliance requirements. And then, on phase 2, the implementation, this is the duration is 2 to 4 months. First in the implementation process is the training and capacity building. To ensure successful implementation of the consignment model, it is essential to equip staff with the necessary skills and knowledge. This involves developing comprehensive training materials that cover various aspects of consignment processes, including inventory management, supplier communication, and data tracking. Conducting training sessions for procurement staff, relevant personnel, and potentially medical staff is crucial to ensure understanding and buy-in. The training should be designed to empower staff to effectively manage the new system and contribute to its success. The outcome of the training process should be documented in the form of completion reports, training materials, and participant feedback. Next is system integration. In system integration, it is a crucial aspect of implementing a consignment model to ensure seamless operation. The consignment model must be integrated with the existing inventory management system. This requires collaboration with the IT department to adapt the software for consignment tracking, incorporating features for suppliers management, stock levels, and usage data. Rigorous testing of the integrated system with selected supplies is essentially to identify and address any potential issues. The outcome of this process should be a fully integrated inventory management system, comprehensive testing report, and documentation of any necessary system modification. Next is pilot program launch. In pilot program launch, to assess the feasibility and effectiveness of consignment model, it is recommended to conduct a pilot program on a smaller scale. This allows for the identification of potential challenges, the refinement of processes before full-scale implementation. Specific departments or types of supply should be selected for the pilot based on factors such as usage patterns and suppliers' availability. During the pilot phase, it is essential to monitor inventory usage, supplier performance, and overall efficiency. Collecting feedback from stakeholders involved in the pilot is crucial for identifying areas for improvements and gaining valuable insights. The outcome of the pilot program should be summarized in a comprehensive report and outlines the findings, recommendations, and lessons learned. Finally, in the phase 3, evaluation and adjustment, duration is 1 to 2 months. First, in evaluation and adjustment phase, monitoring and evaluation. To evaluate the effectiveness of consignment system and identify areas for improvement, it is essential to collect and analyze relevant data. Key performance indicators such as inventory turnover, cost savings, and supply performances should be tracked and analyzed. Additionally, gathering feedback from staff regarding the new process, including challenges and successes, is crucial for gaining valuable insights. By analyzing the collected data and feedback trends, the pattern can be identified, leading to informed decision-making. The evaluation process should be culminate in a comprehensive report that presents key performance indicators, analyzes the result, and provides recommendations for further improvement. Next is adjustment and scaling. Based on the insights gained from the pilot program, necessary adjustment should be made to enhance the effectiveness of the consignment model. Any challenges or issues encountered during the pilot phase should be identified and addressed proactively. A plan to gradually scale up the consignment model to other departments or types of supplies should be developed considering factors such as usage patterns and suppliers' capacity. The implementation of this scaling plan should be carefully managed and ensure a smooth transition and effective management of the expanded consignment inventory. The outcome of this phase should be documented in an implementation plan that outlines the specific adjustment made along with updated performance metrics. Finally, it's the final report and continuous improvement. To ensure the long-term success of the consignment model, it is essential to document the overall process and outcomes. A comprehensive final report should be prepared summarizing the key findings, outcomes, and lessons learned throughout the implementation process. Additionally, a continuous improvement plan should be established to ensure ongoing evaluation and adaptation of the consignment model. This plan should include a process for regular monitoring and review of performance metrics. The ultimate goal is to create a sustainable, effective inventory management system that supports the hospital operational objectives and enhances patient care. Next is result of assessment of BPH medical supplies. And the first graph, the research conducted by Malhotra et al. 2017 revealed that a key factor in establishing a consignment program is determining which product to consign. As a result, products with higher usage frequency and actual component costs are associated with a greater value. In the consignment's perspective, expensive products that are regularly moved in and out of the inventory are better suited for consignment. On the second graph, timely access to essential supplies and a reduced risk of stock-out affecting patient care can enhance patient outcomes as stated in the study of Shukali et al. 2023. In summary, analysis of purchase order from 2022 to 2023 reveals fluctuating demands for medical supplies across different units. This emphasizes the needs for flexible supply strategies. Drugs, particularly in the pharmacy departments, represents the highest expenses, making them ideal candidate for consignment arrangements. Consignment systems offer advantages including just-in-time delivery, reduced stockouts, and optimized inventory management. These factors ensure timely access to medical supplies and improve patient care. Successful implementation of consignment model requires careful planning, investment in technology, and a strong partnership with suppliers. In conclusion, the study emphasizes the importance of transitioning from the traditional procurement methods to consignment systems in healthcare facilities like Batangas Provincial Hospital, which can offer potential efficiency and cost management benefits. An analysis of supply expenditures of BPH shows that drugs specifically in the pharmacy department incurred the highest cost, making them suitable candidate for a consignment approach. Evidence suggests that consignment agreement can significantly enhance inventory management, reduce cost, and improve collaboration between vendors and buyers. Lastly, the analysis of BPH purchases order from 2022 to 2023 reveals varying demand patterns across medical supply, with noticeable increase in demand for certain items, highlighting the necessity for responsive supply. Recommendations. Hospital like Batangas Provincial Hospital should consider establishing in-house consignment centers to streamline procurement processes and ensure rapid access to critical medical supplies. To maximize the benefits of consignment, focus on consigning medical supplies with high usage frequency and significant component cost. This will help optimize inventory levels and reduce procurement lead times. Cultivate collaborative relationship with reliable supplier to ensure a smooth implementation of consignment agreement. Regular communication, shared objectives, and mutual trust are essential for success. Allocate resources to develop and maintain an advanced inventory management system capable of accurately tracking and recording consignment stock. Real-time data and analytics will enable effective decision-making and prevent stockouts. Continuously monitor supply chain performance and analyze demand trends to identify areas for improvement. Make necessary adjustment to procurement strategies, including consignment agreements to align with evolving needs. Invest in training programs to equip staff with a thorough understanding of consignment processes, including inventory management, reconciliation, and supply interactions. This will enhance operational efficiency and minimize errors. References. You can access the references by scanning the QR code. And that is the end of my presentation. I'm Mr. Renato M. Suayan. Thank you for listening, and God bless us all.